visitors. When we have esteemed insight visitors that everybody knows. I assume that you all know Felicia, so I'll go ahead and not take up any of your time. And thank you. Go ahead and begin.
Great. All right, well, thanks everyone for coming. What I wanted to do today was share with you some things that I've become very interested in lately and have only just begun to work on. Now, I'm also aware that some of you know a great deal more about this area than I do. So I'm particularly looking forward to the discussion and to learning from others. So, as ever, I think I need to begin with what is well-being. And well-being, the way I understand it, is a combination of feeling good and functioning well. It's both the hedonic and the eudaimonic. It's not one or the other, but to me it's both together. Now, feeling good is something that's great, but of course well-being does not require that we feel good all the time, quite the reverse. Well-being requires that there are some times where we feel bad. I mean, life can be tough and, you know, sad and bad things happen. And it's entirely appropriate at times to have these painful feelings. So it's not about feeling good all the time, and of course we don't function well all the time. But well-being or flourishing is when we are feeling good, functioning well most of the time. And this just indicates a reciprocal relationship. When we feel good, we tend to function better, and when we function well, we tend to feel good. So, okay, mindfulness. In reviewing the evidence on the determinants of well-being, let me just go back a moment, the determinants of well-being and interventions that increase well-being over the past decade or so, and I've done this in various chapters, and I did a big review for the UK government. I was very struck by the power of mindfulness training and mindfulness practice to improve our well-being. How does it work? I mean, what's it about? I think, you know, many of you here know a great deal about it, some maybe a bit less. It's really simple in a way. It's just about paying attention in a particular way to our ongoing experience. So instead of the helter-skelter of life and letting things pass us by and at the end of the day thinking, what on earth did I do? Where was I? What was happening? Actually pausing, stopping, being in the moment and reflecting on what we are experiencing. Our thoughts, our feelings, the things that are going on around us. And it turns out that when we do that in the course of a normal day, you know, we might not necessarily meditate for, you know, half an hour, we might just pause and do this a few times a day. It turns out that's really good for our well-being. So it is a powerful practice, and it works for a whole variety of reasons. One is, it's relaxing. When you pause, when you stop, and you're in the moment, it's quite relaxing. But it also helps us with self-regulation, and that's an important part of well-being. So, for example, if something happens and we feel quite angry, if we react immediately, we might yell at someone, hit someone, or whatever. But if we pause and we just get in touch with what's going on, we notice what's happening in our body, notice what the feeling state is like. Take a breath, and then, instead of just automatically reacting, we can reflect and respond on the best way to react. So that form of self-regulation is very much assisted by mindfulness. So just, okay, so it's just a way of paying attention to what's going on right now in our minds, our bodies, and the world around us. And we're not all automatic pilot, but it's also doing it in a particular way, which I'll say more about in a moment. And it has the effect of quieting the mind and leading to greater clarity, which in turn leads to better choices and better decisions. Now, we tend to emphasise the attentional aspect of mindfulness, and I know for some people, Rich I think is one, attention and awareness is what mindfulness is about. But I think for some others, we think of three elements. So there's the attentional element where we're actually learning how to, you know, pay attention to what we want to pay attention to. And that's where the intention comes in as well, because very often our attention is captured by things in the world around us. There's loads of engaging things in the world around us, and we can be very focused, but we might not have chosen that focus. So the thing about mindfulness is the intention. We choose where we're going to focus our attention. And then there's also the attitude. And in the sort of tradition that I'm coming from, the sort of secular, John Kabat-Zinn inspired, mindfulness-based stress reduction tradition, attitude is also a really important part of mindfulness. And there's two key components to the attitude. The first is curiosity. This is really interesting. Reflecting on what is the experience. It's really interesting. Okay, the curiosity side. And the other side is the non-judging. So in the moment, we might be feeling something we don't want to be feeling. We might be feeling envious or schadenfreude or ashamed, whatever. But in the moment, let's not judge. Let's just notice with curiosity and fascination what's going on. Now, the reason I'm emphasising that last thing is because the non-judgment in mindfulness-based stress reduction, for example, is part of self-compassion. We're not in the moment beating ourselves up about having thoughts or feelings that we don't like. We're just in that moment accepting them, noticing them with curiosity and interest. And I'm going to be saying a lot more about self-compassion. In fact, maybe right now, but just before that, what I have concluded from all of this reviewing of the mindfulness literature, and it grows by the second, is that mindfulness is not just one of many techniques for improving our well-being. It's actually foundational. It's foundational to all the different approaches that we can have. I mean, there are loads of other techniques, aren't there? There's some, gratitude and forgiveness and character strengths and resilience and all those lovely programs that are out there. But foundational to all of them is noticing, is paying attention and being aware, and not judging as well. So to me, mindfulness is the foundation. But let's now look at whether there are other things that might be as important, more important, who knows. So what's the role of compassion? And as I said, within standard mindfulness-based stress reduction, or MBCT, mindfulness-based cognitive therapy, which is close cousin of MBSR, within those there is always an element of self-compassion. The instruction is always about whatever it is you're doing. Let's say your mind has been wandering and you're supposed to be bringing it back and focusing on your breath. Do it gently, do it kindly. Don't beat yourself up. So there's always this element of self-compassion. And there is data, which we're going to be talking about the importance of self-compassion. But I also just want to say something from a personal experience. So for years, I was writing about mindfulness and how powerful it was, and even working with people developing mindfulness interventions, before it ever occurred to me I should try it myself. So I did, after some years, did an MBSR course. I thought it was absolutely brilliant. Both the exquisite way in which it was structured and taught, and is everywhere around the world, structured and taught very beautifully, but also the benefits were so clear. Even though I don't do nearly enough, mindfulness practice or meditation, any of those things, I never do enough, but it really is, life-changing. But then last year, there was advertised something else called Mindful Self-Compassion, which is a course developed by a couple of Americans, Kristen Neff and Chris Germer. And this was advertised as a course for professionals. And I thought, well, I'd really rather do something on mindful compassion, but that wasn't offered. This is mindful self-compassion. Maybe that's the next best. Okay, let's try it. So went along to this course. Most people were psychotherapists. There was some in education, social work, and a couple of us researchers as well. And I must say, it was, it took mindfulness practice to a whole nother level. It was absolutely astounding. So even the very simple practices that one learns in mindfulness, like mindfulness of breathing, mindfulness of body, all of those simple things, when they had this added layer of a very specific emphasis on being kind to yourself. They just took on a whole new meaning and were infinitely more powerful. So what is this mindful self-compassion business? So Kristen Neff, I think, is the person who's mostly behind that. And she talks about 3 elements of self-compassion. So the first is being kind to yourself. And what she means by that is, let's imagine that you have a friend who's really in trouble, really suffering, really miserable. What are the kinds of things that you would do with such a friend? You'd be supportive in all kinds of ways. That's the quality that you need to bring to yourself when you're suffering. Why is it only, that you support a friend? You actually need to look after yourself as well, in a similar way. Common humanity is recognising everybody has problems. Everybody, at times wishes they had done something differently or were better at something or, whatever. And my suffering is probably no worse than anybody else's suffering. So the element of common humanity. And then, of course, mindfulness itself. So becoming aware of the times when one isn't being kind to oneself and making an effort to change that. So those are the 3 elements. And there's also a very interesting process that they describe. And I actually love the language of this. So when you have a difficult experience, emotion, whatever, there are these various stages of learning how to manage them. So first of all, just turning towards, not turning away, not denying, but actually turning towards. And then tolerating, and then allowing, and finally befriending. Can you imagine even befriending horrible thoughts and experiences in the moment? It doesn't mean you don't want to change them and can make all sorts of efforts to change things that you don't like about yourself or the outside world, but in the moment, when you have those experiences, I think these 4 stages are very, very beautiful as a way of managing these difficulties that we all experience, many times in our lives. So, turning now to the evidence that self-compassion makes a difference. Let me just check that is what I'm going to do. Sorry? I'm pressing.
Yeah.
Oh, I have now.
Is it self-compassion?
Yes, good. Yes, it's not working. Oh, something's happened up there, hasn't it?
Yeah.
Is there an easy way to make sure that when I press a button it does what I want it to do? Okay, so turning to the evidence. A very important study is this first one, done by Willem Kijken and colleagues in the UK. It was a large study of patients. It was in a therapeutic setting rather than the general population, patients with recurrent depression. And they were given MBCT, Mindfulness-Based Cognitive Therapy, just an standard 8-week program. And the first thing that Kijken and his colleagues found is that it really made a difference. There was a proper control group, and the group that had the MBCT had a much reduced likelihood of having further episodes of depression compared with the control group. And as a result, the National Health Service in the UK now recommends MBCT as a frontline treatment for recurrent depression. But in addition, what they did was they looked at what of the many processes that were learned in an MBCT training, which ones did the business? Was it the attention, the awareness, the non-judgment, the whatever? And what they found was that if you looked at a self-compassion scale, it was the changes on the self-compassion scale that predicted whether there would be a further recurrence of depression. So the patients who had become more compassionate towards themselves, they were the ones who were less likely to go and have another depression. The ones who had not changed on that scale went on, continued to have depression. So it was the self-compassion element that really did the business. And then there have been other studies just using short-term inductions of self-compassion. So one showing increased happiness, and the other one I think is really lovely, increased motivation to change for the better. Because we have motivation experts here, but so often our motivations are rather harsh. oh, I must lose weight, or my doctor says, or my partner says. But actually, if we're motivated in a different way, if we say to ourselves something like, I really care about you, and that is why I want you to, whatever, drink less, whatever it is. So if it's coming from that caring place rather than a harsh place, it seems to make a difference. So within standard mindfulness training, as I say, there is an element of self-compassion, and it seems as if self-compassion does have quite powerful effects on well-being and factors associated with well-being. I want to move now to something that is quite closely related, and we're going to talk exactly about how much these things are related, and it's the idea of empathy. So self-compassion, of course, is about the self, whereas empathy and compassion are about our relationship to others. So what is empathy? Basically, it's about being in someone else's shoes, seeing things from their perspective, and understanding what they're experiencing, thoughts, feelings, and so forth. And it's a very important and powerful thing. Let's just take an example. So if you see someone being jabbed with a needle, you often flinch. I mean, it is just a hardwired experience where we see someone in pain and we tend to experience some element of that pain or suffering ourselves. Empathy can apply to joy as well, actually. If we see someone, delighted and joyful, we tend to feel some of that ourselves. And what we know about the neuroscience is that some of this is related to what's called mirror neurons in the frontal cortex of the brain. And interestingly enough, these were discovered not in relation to emotion, but in relation to movement. So in a functional magnetic resonance imaging situation, participants were being asked to make certain movements. And it was observed that the very same parts of the brain, some of the same parts of the brain, were also activated when they were merely observing others making those movements. So the mirror neurons are very general in relation to observing others, whether it's movement or whether it's emotions, thoughts, whatever. So they play a very important role, and it's been suggested that they evolved because we are hugely social animals, and in order to be able to get on with each other, we need to have some sense of what the other person is thinking and feeling, and that's theory of mind. So the mirror neurons are part of all of that. They seem to be hardwired. So if that's the case, if it's hardwired and it's based on these, these mirror neurons in our cortex, do we always feel empathy when we see someone in pain or in joy? Or is the empathy response modulated by the nature of our relationship to that person? So that's a question that I want us to look at. And some of the earlier work, Tanya Singer and her colleagues addressed this. She's an absolutely brilliant social neuroscientist, originally worked in London, now back in Berlin. And she did a lot of the early work showing that if you had partners, both in a scanner, in the MRI scanner, and either you or your partner would be experiencing pain, a jab in the hand or whatever. And she looked at which parts of the brain were activated. And what she found is that if you're experiencing the pain, then both the sensory and the affective pain pathways are activated. But if your partner's experiencing the pain, the sensory one isn't activated, but the affective pathway is affected just as much as if you were experiencing it yourself. Now, in terms of modulation, she then looked at non-partners, strangers, and still the affective pathway was very, very strongly activated, even if you hadn't met this person before. But then she introduced some interesting conditions, whereby there were volunteers, men and women volunteers, and there were a couple of Confederates. And each volunteer took part in a so-called economic game, with a confederate, where you give a certain amount of money and they give a certain amount of money and so forth. And it's a way of discovering if the person is playing fair or not. So these confederates were instructed either to play fair or to not play fair. And then the question was, when they had pain inflicted on them, what was the response to the pain? And it turned out to be very interesting. So when they played fair, the response was enormous. Okay. When they played unfair, for the males, the male volunteers, that was it. The empathic response disappeared. And not only that, but there was an activation in the reward centres, where the males were really pleased that this unfair person was getting punished. Didn't have the same effect on females. So what we're starting to see is some of the circumstances that lead to modulation of this hardwired response. Now, another example is in this video clip.
I've been researching this back in my laboratory, and here was my main question. When we interact with someone, does our brain function differ according to which group they're in? For every in-group we belong to, there's at least one group that we don't. And that division can be based on anything: race, or gender, or wealth, or religion.
This, by the way, is
130
David
participants in the scanner. Here's what they saw. 6 hands on the screen, and the computer randomly picks one of these, and then that hand gets stabbed by a syringe needle. Now that activates the pain matrix, which is what comes online when you're in pain, or you see someone else in pain. Now here's the trick. We now added a label to each hand: Jewish, Christian, Muslim, Hindu, atheist, Scientologist. And the question is, do they care as much when they see a member of their outgroup getting stabbed? So here's what we found. Here's a subject, and when he watched a member of his in-group getting stabbed, there was a large neural response in this area of his brain. But when he watched a member of one of his out-groups get stabbed, it was essentially a flat line. We scanned a range of volunteers, and there are individual differences, but the trend is clear.
A single word label is enough to change your brain's basic pre-conscious response to another person in pain. In other words, how much you care about them. Now you might have opinions about religion and its historical divisiveness, but even atheists here care more about other atheists' hands getting stabbed than they do about other people. So it's not really about religion. It's about which team you're on.
Right. I find that a really dramatic and disturbing illustration. By the way, I haven't been able to find a peer-reviewed version of this, but I'm taking it at face value that this is right. So we do live these days in a really toxic them and us culture, and this is showing the how extraordinarily powerful these divisions are. It'd be lovely to see what intervention could be developed that would reduce this distinction, this difference in brain activation between them and us. And by the way, I think the fact that he mentioned big individual differences is also very important. But if anyone has the opportunity to actually do these studies using brain activation as an outcome measure, I would love to hear about it, love even to be involved. But I think it's incredibly important today to start looking. Yeah.
In these kinds of studies, how many people do they have typically?
I wish I knew. As I say, this isn't a peer-reviewed publication. This is something I came across because this guy's put out a really interesting book recently on the brain and you, something. So I don't know the answer to that. Yeah, and maybe I shouldn't even be showing it to you because it's not going to be replicated.
The answer is 7.
Is that right?
Thank you.
Are you talking about the number 7?
They tend to have low sample
Low,
sizes,
yeah.
that's all I'm saying.
They do have
Can I just say, showing that the brain lights up, didn't we already know that people didn't favor groups that are not out groups? I mean,
Yes, well now...
and a difference in the brain too. You know, like, I think we could
Exactly.
say, and
So
all the brain
what-
research is
absolutely.
summarized,
So-
and a difference in the brain too.
Yes, okay.
Where else would it be? It's not like we have. Anyway, it's not trying to get information. I'm just that's what it's just having an issue.
No, I think that's very good. I was going to link this to the work that Paul has done on importance of appraisal in relation to empathy and compassion. So, in terms of
That's important work.
What?
I said, now that's important work.
So the idea is that there's a series of responses that happen when we're looking at another person, let's say, another person suffering. So there's first of all noticing, that's mindfulness bit if you like. Then there's appraising, and we'll come back to that. Then there's feeling, and then there's action. Now, what does the appraisal part involve, according to Paul? First of all, similarity. The extent to which the person you're observing is like you in terms of their appearance, their values, whatever it is. The second thing is deservingness. So let's imagine that it's a healthcare setting and someone's got lung cancer. It makes a big difference sometimes to a healthcare worker whether they brought it on themselves because they were a smoker or whether they've never smoked. So there's often an appraisal to do with deservingness. And then the third thing is one's own estimate of whether one can cope with the suffering. And if you're confronted with some terrible suffering, but you just think, oh my God, I'm not going to manage, I'm going to go to pieces, I can't deal with this, that too can modulate the response. And you're quite right that we've known about these sort of things in behavioural terms for quite a long time. I personally do feel an additional strength from the neuroscience. But again, the really important questions are, what can we do about it? And I don't know that we have the answers to that, really, now. There are a lot of things going on. For example, teaching small children to be more empathic. And there's that lovely Canadian program that's been going on for many years called The Roots of Empathy. You might know all about it. Where a baby is brought into primary schools for once a week for a whole year. And the kids learn to sort of see the world through that baby's eyes. You know, what is it that makes the baby laugh? What is it that makes it cry? You know, what is the baby noticing? What's going on? So really trying to get into that baby's shoes. And that has led to some really interesting outcomes in terms of how the primary school kids respond towards others. Most of the interventions, though, haven't been evaluated, and certainly not in the long term. But there's, for instance, the kindness curriculum that Richie Davidson, another great neuroscientist, has been developing, shows various kinds of benefits, in factors associated with well-being, although not well-being directly. So, for example, the kids who've been through the kindness curriculum, which is just 12 weeks long, are sort of more socially aware. They're also, they're not into instant gratification. They're much better at delayed gratification, things like that. So those are not the progress. There's one I heard about recently that's happening in various parts of the world, including the UK. And it comes back to this idea that one way of dealing with these problems of the in-group and out-group is to use our curiosity. And to be really curious about people who are not like us in whatever way we define. And a lovely way of doing this is via this thing called the Human Library. So they've got them set up in the streets of London and various other places. So instead of borrowing a book, you borrow a person. So whether it's a homeless person, a single dad, whatever it is, you actually borrow that person and talk to them, ask them about their lives and try to see things from their perspective. I think it's a very beautiful approach. So I think there's a lot that can be done. Okay, so let's now look at whatever that's it. Findings from studies of what?
Social emotions.
Oh yes, okay. So here's where we want to get on to the difference between empathy and compassion. So empathy really is sharing the suffering of another person. Compassion is something different. It's not about sharing their suffering, but rather having feelings of warmth and care and concern and a strong desire to help. So the way it's sometimes summarised is compassion is feeling for someone, whereas empathy is feeling with someone. Now, why does this matter? I think it matters enormously because, as we'll see, really, if you go on having an empathic response, continuing in relation to suffering anyway, so let's put joy aside, all the research is done on suffering. If you go on suffering with someone, it's not good for you. It is really problematic. And so the social neuroscience has been, has been looking at this. So what are the characteristics of empathy? First of all, there's negative affect, because it is very painful and stressful and unpleasant. It's self-oriented, because what's happening when you have a strong empathy response is you're aware of what's happening inside you. So it's self-oriented. And that in turn can lead to withdrawal and avoidance, because it is so uncomfortable. And too much empathy is associated with poor health and burnout. In contrast with compassion, there's positive affect. Okay, there's love, growth, whatever. It's other-oriented. It's associated with approach and wanting to help, and with good health. And looking at the neuroscience, because I do think this is actually very interesting, what happens when you put people in a brain scanner and they're either having an empathy induction or a compassion induction? So the empathy induction is typically showing photos of people, in war zones or, and having had terrible accidents or something like that, and you're just confronted with these pictures. So which parts of the brain are activated with an empathy induction?
So to make sure, empathy induction is just showing people in distress?
Yes.
So it's not intensity, it's empathy. Because if you're going to war zone to be very intense,
Yes.
then more people will suffer.
Yes.
So that has to be controlled for, I guess.
You're right, and I'm not sure how carefully it's been controlled for.
So you're saying that before they look at the pictures, they're asked to empathise with the pictures?
No.
Right, just shown.
But yeah, that's a good question. I don't know the exact wording of the
Yeah.
induction. I think that's an important question, yeah.
I just want to go one step further. There's been a long tradition in empathy of two types of empathy. One is called personal distress empathy, in which you want to help somebody else because you can't tolerate the uncomfortable feelings. And there's another one which is, I forget exactly what they call it, it's the other empathy, which is, and that's where you care about the other person, and you're not trying to relieve them because it's bothering you, but rather because you care about their outcomes.
It's going back.
And there's a long tradition in this.
Charlie Bateson and,
Yeah.
And there's more of a perspective
Davis is-
taking empathy that is more like I can take the other's perspective, but doesn't necessarily have a big emotional weight.
Yeah.
Right.
And
No, I think that's very interesting. So what would be the implications? So
This seems like an undifferentiated,
Yes, it
get
does.
people to feel something, but you're not distinguishing within it. It could be, if I saw someone in a war zone, I could have personal stress empathy, but I also could have perspective taking or a kind of caring empathy. I guess it's empathic concern is the third one.
Yeah.
I could have a real
So
concern
I
for
think
that.
this is where we get this muddy distinction between empathy and compassion. Because one way of thinking about this is some of what you're talking about is empathy, but some of it is compassion. And the perspective taking, I wonder if that's moving more towards the compassion.
Well, I'm saying that there's a distortion in at least the old literature on empathy if it's only being shock people with bad situations which are distressful to see.
Yeah.
Yes.
There is definitely, there's the distress, affective empathy, and then there's
Empathic
empathic
concern.
concern. I think you're right, that seems to mix compassion. But there's a cognitive empathy which doesn't imply prosociality necessarily. You could be a con man, really good at taking another person's perspective. But empathic concern, I think, does kind of imply prosociality. So that one's mixed with.
And I think, I mean, one of the struggles in this area that I've certainly had, and we're opening up now, is people use the terms so differently and so confusingly. And yeah, maybe someone's written a great review of it. I haven't seen it.
Well, this distinction has been around for a long time, and the most central measures in the field, which were developed by Davis at Eckert, they have these three
Yes,
dimensions.
Davis and the IRI, yeah. Yeah, but and maybe what we need is to have more nuanced studies in the neuroscience area.
Yeah, I think so.
I think that may well be the recommendation. But if I can just proceed with what there is, because I think this, even with its limitations, probably tells us something interesting. Okay? So yes, accepting that this could be a lot about distress. What we're seeing is the neurons, as we would expect, and the other networks associated with theory of mind, the negative affect areas being activated, and also, interestingly, the integration of interoceptional bodily awareness with cognition and affect. And again, that's rather self-oriented, because I think what that's saying is awareness of the uncomfortable feelings and thoughts one's having. And that does contrast really quite strikingly with what's happening with the compassion situation. And in this situation, I think it's a very short kind of love and kindness induction. And what's happening there is the activation in affiliation areas to do with love and bonding and so forth, and positive affect. And also, very interestingly, in the reward centres. So I totally take your point that these are not perfectly controlled for each other. But what is very interesting here is that in terms of the brain activation, there's not any area of overlap between those two, at least. So the empathy condition activates areas that are totally not involved in the compassion condition. Yeah.
Does this confound positive and negative? I mean, you can have positive empathy. You can empathize with somebody's joy. And I would guess that that would have a different brain function than empathizing with somebody's pain.
Yes, you're absolutely right. And as I said, the researchers all seem to focus on pain rather than joy, but that is a gap, and that's something that obviously does need to be done.
Was it possible that they've used the same exact stimuli in both of those, but they just had a different framing and structure? Because it seems like amazing that the content is so different as well, that it would be so compounded. I'm just wondering if they had like the same scene maybe, but in one, I'm guessing the right design would be to have an empathy instruction, and the other would be.
Does anybody know? I mean, I should have looked this up.
I think it is that they have a different instruction.
But it's the same stimuli?
Yeah, and that they look at the same.
They look at the
They
same
look at the
thing.
same series of pictures, but they've had a different induction.
Ah, yeah. Okay,
So
that controls
do you
that.
know what the induction was? I mean, I should know.
I can't remember
Apologies.
clearly, but I think with empathy it was about trying to imagine what they're feeling, and compassion was more about wishing them well, or that sort of warmth and love and kindness.
Okay, well that's reassuring if that's the case, and yeah.
But the same stimuli, I guess.
Yeah.
Okay. So that gets around the intensity thing. And, Okay. Okay, so then there's a question about compassion interventions, because we haven't so far talked about that, specifically. Now, the most common compassion intervention that's been used is this thing called loving kindness, where the idea is that you wish people well, whoever they are, whatever they are. And it's a particular practice that is quite formulaic. A lot of people find a bit like that, where basically you normally start with yourself, wishing yourself well, and you say things like, may I be well, may I be happy, may I live with ease and with kindness, something like that. And then the instruction is to go on to someone that you're very close to, someone you love, and you wish them well. And that's usually a much easier thing to do than wishing yourself well. That's sort of compassion part of it that a lot of people are finding tough. So you then go on to this person, and it's very easy. Then you go on to a neutral person, someone like, the barista who makes your coffee every morning. Maybe that's not neutral.
That's not neutral.
No. And then
start with it.
Yeah. And then
root your wife.
And then finally, you go on to someone you don't like. It's someone who, and that can be very, very tough as well. Wishing well to someone you don't like. Now, obviously if you're a good Buddhist or a Catholic saint or something, none of this makes any difference. I mean, you can wish well to all of them. You'll be empathic, to everybody. But most of us are not like that. And so, this really requires a lot of work and a lot of practice. And this particular technique, this loving kindness so-called technique, really does not work for a lot of people. Nevertheless, it has been used, and Barb Fredrickson, her study on this is one of the best known, but even Barb says that about a third of the people in her sample just didn't get on with this particular way of creating compassion. But what did she find? So she did a study in a large IT company, asked for volunteers and randomly assigned them to loving kindness meditation or weightless control. And on a daily basis, she got ratings of positive and negative affect. And that using this particular scale. And here's positive affect over time. So in the weightless control group, it was pretty much flat. In the compassion group, it did steadily go up until that last week when they had finished, and then there was a slight decrease. So there was pretty strong evidence that this particular intervention did improve the hedonic part of well-being. What about the other part, the functioning, the eudaimonic part? Likewise. And some of these were objective measures. So there was an objective measure of cognitive flexibility, then there was this thing about expectation. Then those of you who know the RIF psychological wellbeing measure will recognise the next four as four of the subscales from the RIF. There were significant improvements on all of those. And then also, very interestingly, reports on more social support received because you were more compassionate. And I think that's lovely. And the final one is an objective measure. Clearly, illness symptoms were reduced. So there do seem to be benefits of this form of compassion training to both sides of the well-being.
It's interesting though that it's always focused on the self. That wasn't supposed to be being kind to others. I wonder if they're actually nicer to others. Or if they're just really just pleasuring themselves. I'm just wondering. Yeah, probably. Probably
Well,
are.
that raises a whole interesting issue about the importance of altruism and whether by doing things for others and in a totally selfless way is even possible, or whether it always it gives yourself benefit. And again, it's very early days, but I think that finding that in that compassion condition in Tanya Singer's work, there was the activation of the reward centers. So it could be that whether you like it or not, feeling compassion or doing compassionate acts might trigger your reward centers.
But there is, Felicia, we found a lot of evidence. We just published a large series of studies in the Journal of Personality on benevolence, which shows just the same pattern of results. So it's the more benevolent you are on a daily basis, the more all these well-being indices go up in the same way.
Yeah, I mean, and I think that can still be called altruism at the level of action. It doesn't have to be a feeling state of sacrifice.
And it only works also if it is altruistic. In other words, approximately, you're doing it for altruistic reasons. It doesn't work if you think you'll get benefit. If you're doing it for
Well, now you've ruined it for us now. But this is going the other way, which is to say that practice is making them feel better, but we don't necessarily know that they're doing better. We know that you're saying if they do better, they'll feel better, but we don't know that they're.
But there is research that we've done that, if you engage in activities out of harmonious passion, you experience more positive emotions, and then you develop and maintain better friendships with other people, as perceived by yourself and by the other people as well.
Yes.
Okay.
So emotions is very important.
Yeah.
But if you get in there out of obsessive passion, and then you experience negative emotions, that drive people away.
Okay.
So these positive emotions that Barb has found in her research are very, very important for, in a interpersonal relationship perspective.
So please pass on those papers.
Sure.
Yeah. Let me just finish and then maybe we can come back to altruism, because I think it's going to come down to how we define it to some degree. I mean, if every time you think warmly about others or do something nice for others, if that's the case, you get this activation in your reward mechanism, what meaning does altruism have?
Well, because you can define it at the level. So David Sloan-Wilson has written a whole book on this subject, and he says you can define it at the level of behavior. And so it's the act of giving that makes it altruistic, not necessarily the feeling.
Right, yes, so it's the motivation,
It's not
the
the derived
intention.
outcome, it's the extension.
Okay.
Yeah,
Okay.
so if evolution has selected people to be rewarded by being giving and connected, then fantastic, but it's not necessarily, it can't be called selfish. That's just from that definition, if the act itself is giving to the group.
Well, the paradigm also that, Bateson has developed in his lab, where, you can leave whatever you want, but you can take the place of that person who's suffering, and you still do it, even though you can leave, that's very compelling too.
Yeah. And David Sloan-Wilson looked at the history of kind of selling altruism to people that they should do it, and it's almost always characterized as win-win situations. If you do this, it'll be good for you and the group. It's rarely like you do this and you're going to lose everything and it's going to suck. So being good is sold as being good for you as well as for everybody. It's rarely sold as, and you're going to have to sacrifice everything.
Okay.
Even religious groups do this apparently, the way they characterize it.
That sort of fits in with your control button.
And sport, yeah.
Eradicates, that was the baseline for their success last
Was
year.
it?
Yeah. So they kept it a secret that they were doing mindfulness until they won.
Ah.
Yeah, and there's some really good YouTubes with Maguire talking about the connectedness with the team players and their own self-regulation, which everyone expected. But it's that idea.
So they were
It's not
sneakily doing
scientific, but it's
mindfulness.
there. Yeah,
So they're doing secret mindfulness.
They did.
So
Mindfulness.
they became more connected to beat other teams.
That's
terrible.
Exactly.
That's
But then it's in the
That's what the cows need.
Secret altruism.
Okay, so just to summarise briefly some of the systematic reviews, meta-analyses of compassion meditation and its benefits, and the sort of things we'd expect. The last one is quite interesting because that's an objective measure, a measure of empathic accuracy where you see pictures of people's eyes typically, and then you have to choose what emotion they're experiencing. So that is improved following the compassion training. Okay, so finally, coming back to mindfulness. Now, generally speaking, MBSI, MBCT are about the self. It's about, it's oriented towards the self, including kindness to the self. But it's been suggested that that should just by itself lead to greater compassion, kindness towards others. And the question is there any evidence for this? Or do we need those specific compassion inductions or compassion meditations on top of the mindfulness? So this was something that excited everybody last year. It was a study by Lin et al. Where there were two groups. One group did online mindfulness training using Headspace, which is, I'm told, a very good program. Control group did 3 weeks of cognitive training online. At the end of the 3 weeks, every individual was invited into the lab to do some cognitive testing, and they were put in a waiting area. And unbeknownst to them, there were a couple of Confederates there. They were, sorry? There were three chairs in the waiting area. 2 were already sat on by Confederates, so they sat on the other one. Within a few minutes, somebody came in like this, on crutches, looking in pain. And the question is, did they get up and give their seat? Were they compassionate enough to do that? So it turned out, as predicted, that in the mindfulness group, more than twice as many gave up their seat compared to the cognitive control group. But as everyone here I think knows, there's a lot of flaws in this study. The first of which is, we don't know if this was a compassionate response, giving others. I mean, for example, one of the things it was confounded with is the bystander effect. And it may be that the mindfulness training just reduced the bystander effect, and so you were less worried about doing something even though other people weren't doing it. But I think the other part of this that is truly shocking is the very low number, only about 1/3 of people, even in the mindfulness group, gave up their seat for someone on crutches expressing pain. I think it's just astonishing. Sorry?
I've just done quick calculations there. 27 people, 30% of that is 9. 29 people, about 1/4, 14. How much is that? I did wrong calculation. It looked to me as if 2 people are more in the green group than in the other. I'll have to do a little bit more calculation.
Okay.
It doesn't look that much when you look at the numbers.
Yeah.
And then when I was taught statistics, everybody said if the numbers is smaller than 100, don't present percentages.
I think these were reported as
10 versus 4.
And that's good. Yeah.
I mean, these were reported as significant differences, and I remember there was a great deal of excitement when this came out last year. Yeah, but I think you're just...
Especially if you sell the Headspace app, you'd be really excited. I don't want to be that cynical. I think mindfulness probably does it. It's good to see.
Okay, so in terms of objective measures of not necessarily compassion towards others, but an effect on how we relate to others, I had a master's degree student who did, I think, a nice piece of work recently, using the IAT, the implicit association test. So she developed a version of the implicit association test where words for self or others were paired with words for cooperation or competition. And you look at reaction times to see which words are actually closely linked in the individual's unconscious mind. So what we found before the study, a group that was going to have MBSR training, standard 8-week course, before the course, the response was fastest to the pairing of self and competition. So the idea, the way this is interpreted, is people thought of themselves as competitive. Maybe thought is too strong a word because it's unconscious, pre-conscious. However, afterwards, the fastest response was to self and cooperation. So clearly there had been a shift. The other pairs showed very little change, but there was an enormous change in the latency for this particular pair.
And this, just remind me, it's not just mindfulness, this has compassion elements in it.
No, there's no compassion elements in it. It's just, in the UK, MBSR is very strictly attention and a bit of self-compassion. There is no compassion in it. I know people who do it over here and other places might have a session on compassion, but not in this one, and not usually in the UK, although Jean knows much more about that than I do. No, there was no training whatsoever in compassion towards others.
Yeah, I was taught in Australia, but we definitely, so I take your point, but we definitely, I use loving kindness in every MBSR course I teach, and that was the way I was taught.
Yeah.
But I was taught in Australia, so...
Yeah, so that's what I've heard. Yeah.
So there's no loving kindness in the UK? On camera, you must say Felicia, Huppert says.
the three of them rewrote the book just a couple of years ago with the MBCT handbook. That they debated whether compassion would be implicit or explicit within the guidelines for teaching, and they decided to have it implicit.
Yeah.
So
So
I'm trained to teach MBCT, and we never mention the word compassion, but the use of language in the teaching gets people to understand compassion for themselves. And when we put the NEF SCS measures against beginning, post and pre, we get quite a lot of change with those measures.
I mean, there's just a kind of gentleness and compassion in the way that it's taught, isn't it? And it's just
It's
embodied.
it's
embodied. It's
quiet, gentle.
Yeah.
So I wonder if, I'm just wondering if mindfulness has a compassion ingredient inherent in these kinds of interventions.
Well, Felicia made the point early on that all the instructions always say, gently coming back to breath without beating yourself up, with kindness. So there's that sort of self-compassion element is very strong.
And the key thing is not to set up a pass or fail situation. That's why some people find it so difficult if they're being traumatised. They're trying to feel compassion and they can't. Whereas with the MBCT, it's just noticing what's there the whole time, and gradually you see the change. They see the change for themselves.
Right. So I think what this is getting towards, although the evidence is not very strong here, that mindfulness alone, without specific reference to compassion towards others, might have the effect of changing the way we do relate to others in a positive way. More probably needs to be done. But almost certainly, that change is not as great as it would be if there was explicit, that's my hypothesis, if there was explicit training in compassion. I'm suggesting that it would be even stronger, because the studies that have used explicit compassion training have had really quite strong results. So, my conclusion from all this is that while I still believe that mindfulness is foundational, is fundamental, we may also need the additional side, the compassion side. And it relates to this, this image from Buddhism, where with mindfulness, what you're doing is you're building up this, this muscle of a bird, let's say, building up this wing to become really, really strong. If you practice mindfulness. But of course, if that's all you do, you're going to fly in a very lopsided way. So you actually have to build up this other one, which is the compassion. So that's, and if you do both, then you can really soar. That's the hypothesis. We need, either we need lots more research, or I need to know more about what's already been done to actually make that case, or learn that case has already been totally made. Okay, open to discussion.
Yeah. So we currently, we just recently started a systematic review looking at mindfulness interventions, compassion interventions, and the evidence for their impact on pro-social behaviour. Mm-hmm. So that'll be interesting to see, sort of gathering up what's at least out there already. Yeah. Probably not much, but
very good.
Sarah's been doing that study. We've been looking at self-compassion in adolescents across the whole high school period, and we find it relates negatively to affective empathy. So people who are more self-compassionate have less affective empathy, but they're still we have an observer measure of helping behavior 2 to 4 years. And they are still likely to help, despite having less of an affective reaction. But when you look at it developmentally, self-compassion does not lead to empathy. Empathy produces more pro-social behavior during the high school years, but self-compassion doesn't. So empathy still looks like the main game in town for that. I mean, I don't know, there'll be other things to look at, but self-compassion does not lead to
So you're saying self-compassion as a sort of trait measure?
Yeah. Does not predict the development.
Training or anything. Yeah, just the
yes, but that, there's masses of stuff on correlational.
This is longitudinal, so it's...
Well, it may be longitudinal, but there's no intervention, as I understand it.
No.
Yeah. So I don't... very interesting, but, how one interprets that.
But I actually say, well, interventions are hard to interpret, because they have, MBSR has 17 different things going on. A caring, compassionate person showing you kindness.
That's true, too.
So,
But of course you're still left with the question, you know, what is it that makes one kid have lots of self-compassion and another one not? And maybe whatever that is what's influencing the results. Yeah. So yeah, look, there's
but it
maybe
looks,
not a perfect example.
so when you look at the development of pro-social behavior in adolescence, it looks like empathy is the clear winner over self-compassion in our data set over 4 years. So I don't, empathy, affective empathy and cognitive empathy.
It's positively related to cognitive.
Sorry?
It's positively, so self-compassion is positively related to cognitive empathy, but not developmentally.
Yeah.
Is that right? But it's negatively related to effective empathy.
That's really interesting. So is this published yet, or?
I'm just writing it up.
She's working on it. It's going to be for the next week.
It sounds very, very interesting.
It was empathy, though. I mean, the idea is that there are a lot of arguments out there just assuming that if we promote self-compassion, people will become other-oriented. And I think I think there should be questions. Assume the Dalai Lama says it. Everybody says it.
Everybody says it. But so in your review, do you know if there have been studies looking specifically at that? Do self-compassion interventions increase compassion towards others?
They don't tend to correlate, naturally. So people who are self-compassionate people who are compassionate to others aren't necessarily compassionate towards themselves.
That's true.
But I think with self-compassion training, that changes.
I think there's only two that have looked at it. One of them is connectedness to others, and that did change in one of the intervention studies, and then another one it didn't. So that was two compassion interventions.
Self-compassion.
Looking at connectedness. I think that's correct.
Yeah. Okay. So 1 out of 2.
So I didn't quite catch. Did you say self-compassion interventions, and what was the outcome measure?
Connectedness to others, so the person's perception, their perception, so not,
Okay.
whether they felt more connected. That's as good as it's got as far as I've found, but there might be.
Right.
Yeah.
We have actual observations of behavior, so that's it's another level. People can have themselves on.
Very interesting.
Belginder has examples of people in her long-term mindfulness study who become more selfish, don't they?
It's not quite the same.
Oh, she's not supposed to report that data, sorry.
Data analysis underway.
Mindfulness is also going to get one.
It's not quite the same construct, but I'm pretty sure that I know of a review paper around judgmentalism of the self is very much related to judgmentalism of others, and also acceptance as well. So these are in the same territory. I mean, so I've written about this in sort of different ways, thinking about how we think about the self. You know, how we think about whether we attach ourselves to rather rigid labels. So using very much sort of conceptualised self, and if we conceptualise ourselves positively or negatively, if we're really attached to self-concept, then we're also likely to attach that to others, if that makes sense. So, I'm probably going to have to go into it in more detail, but it's that core element of how the extent to which we're kind of labelling others and categorising others is related to the extent to which we label and categorise ourselves. Which I think is a key part of whether or not we're compassionate. Like when we learn mindfulness, we're learning to sort of step back from that whole labelling process, that whole judging process.
Yeah. And this self-compassion measure, I think it's nice, but it doesn't have the big scale has mindfulness and things like that. It mixes everything together. This one doesn't, so it may be that the mindfulness component is really important component of that self-compassion.
Self-compassion can be done for so many reasons. I can see, narcissistic people, say, I should forgive myself, but not others.
Yes.
So they could be highly specific too.
Yes.
I heard some literature.
It's true.
Yeah, I think that the common humanity in self-compassion is sort of key in terms of, like, you would imagine in common, if you're trained to see people as similar to you, we all suffer things in a common way. you can imagine that would shift how inclusive you see your in-group or out-group, and then maybe how much empathy you feel for other people. So I think there is a difference between mindfulness and self-compassion as an additional, including others in how you see suffering beyond just yourself.
Yeah, there are about 5 dimensions in there, aren't there? Like in the self-compassion, some of the self-compassion skills have multiple dimensions.
Yeah.
Have you guys looked at those in your study?
We're not able to have a big scale.
We've got the short form, but yeah, particularly with adolescents, I think that's a good point, because that's something that, you know, might be more self-focused as opposed to be able to see that others are feeling the same or that sort of thing, but we've got the short form version.
It'd be really nice to have common humanity. I agree. That's the key. When I do an actual intervention, that's like one of the biggest ingredients. It's like, look, this is normal.
Yeah, it's what makes it not selfish. I mean, how people perceive self-compassion. I can see it as just having compassion for yourself or the common humanity is a key, I think.
So I think what I'm learning is that there's lots from sort of earlier literatures that's very, very pertinent to this that, you know, perhaps I don't know about others, should be more aware of. There's also lots and lots of nuances that have not, I think, been properly investigated as yet. So, you know, rich area for future work. But yeah, look, I don't know if we could maybe have other brown bags on this subject, but in the meantime, maybe if we start collecting a really good database of publications, and the systematic review sounds terrific. So yeah, if we can sort of keep everyone in the loop, that would be really
Do a brown bag on it in the end?
Sorry?
Do a brown bag on it in the end, James?
That'd be awesome. That'd be a really good idea.
That'd be
fantastic. You do a team on how many people on the team? 10?
10.
It'll be like
4 or 5.
It'll be like Robot Wrestling, you could do tag team.
Wow.
Oh, we're just going to ask hard questions, tag me out.
Okay.
You sound so not compassionate.